We've seen a lot of chatter about compounding 5-FU and calcipotriol, and the most commonly asked question, of course, is can we as compounders make it? So, we at Flux decided to act as the go-between. We spoke to a representative of the New South Wales Pharmacy Council. We chose New South Wales because they have the strictest guidelines of any pharmacy authority in the country. Just ask any New South Wales compounder. As expected, there was no red light or green light answer. However, all was not lost. Our contact at the Pharmacy Council made some great suggestions for things that must be considered prior to undertaking this hazardous compounding activity. Now, of course, we might not be telling you anything you don't already know, but it is sometimes good to get some confirmation. Step 1, risk assessment. As in all things in compounding these days, you must perform that risk assessment. If you're having trouble with your risk assessments, Module 2 of the Flux program covers everything you need to know. In your risk assessment, remember the 4 Ps: product, personnel, premises, and patient. The benefit of compounding this product must outweigh the risk. Suggestion 2, formulation stability. You must show that your formula is stable, and this will more than likely include performing a stability study on your formula. Now, we have some tricks up our sleeve at Flux to be able to minimize these costs for you. And these tricks are accessible to all of our members. Membership is just $49 per month. And suggestion 3, perhaps often overlooked, efficacy and evidence including peer-reviewed papers. Now, there may be an additional level of regulatory scrutiny given this formula's hazardous nature. I would say anyone wanting to make this would want to have their ducks in a row for this compounding activity. Here's a tidbit for you. It will help to show greater efficacy of this compounded product for treating precancerous lesions and AKs than methyl ALA, which is indicated for mild to moderate AKs on the face and scalp. We have done a little legwork on this, and there are some papers available for our members. Finally, as Flux Knowledge Director and Australia's Queen of Compounding Documentation, Brianna Porter would say, document, document, document.
If it's not written down, it never happened.
Completing all of these will help prepare your pharmacy to stand up to the rigours of any regulatory inspection.